Very happy New Year to all of you. I would start by saying a few numbers, I think, just to get some perspective on it. I think that will set the context. 2,300 camps, 1,60,000 screening, 3,500 surgeries, 80,000 heart transplants, and 11 years in functioning, and that's assurance. So I would say by beginning this, because this press conference is organized for two kids which are underprivileged, and how Dr. Bala and team and Ashura Trust stepped up and helped them to provide a quality of life. I always firmly believe that healthcare is an ecosystem which is a social enterprise, and which should actually help underprivileged and the entire ecosystem of the country. And according to that, I firmly believe what the team is doing at this stage is something which is phenomenal. And this helps the entire strata of society. And this is actually possible by the vision of Dr. Bala and team, along with Chitra ma'am from the Ashura Trust, and MGM coming along and supporting this cause. So I would rather say this is a great beginning for all of us in this region, and we've been doing phenomenal amount of work. I've been associated with Chitra ma'am and Dr. Bala for almost now 6 years. We have seen many milestones which have been achieved by this team, and I think this is something which is extraordinary. This can only happen by having a long-term vision and consistency in terms of what they want to do, and also the support mechanism which is created by Chitra ma'am to help the underprivileged children over a period of last 11 years. And this is phenomenal. I think no other program has got this kind of a mechanism where we actually can support entire strata of the society, and that's something which is phenomenal. And I would rather congratulate, and I've been privileged to be associated with Dr. Bala, Chitra ma'am, Dr. Suresh Rao, and with all of them for providing such a wonderful opportunity for the people across the society. So
it's a great privilege to be here to present the interesting stories of two young girls who had the courage to fight against the end-stage heart failure and to get a new lease of life with the heart transplantation. The first fortunate young girl is 17-year-old, studying in 12th standard. Her father is basically a battery salesman. She presented to us with severe breathing difficulty. She's a known case of dilated cardiomyopathy. She was on medical treatment. However, after a few years, she was not responding to any of the medical therapy. Her heart failure worsened, and the end-stage heart failure which required a heart transplantation. The sad thing is they were unable to fund the surgery, but we were fortunate enough to have the Aishwarya Trust. When we approached Mrs. Chitra, she readily came forward, and also the management of MGM Healthcare was kind enough to give a subsidized cost. So on 26th November, there was a young donor in a private hospital in Chennai, and the total ischemic time was 2 hours. That means the heart was outside the body for 2 hours. The moment it was taken out and implanted into the recipient. It was a successful surgery, and after 2 weeks we did a myocardial biopsy, and there was no rejection. So she did well, and she was discharged on 20th December. Basically, when you do a transplant, the surgeons will put the child on cardiopulmonary bypass. That means there will be artificial circulation of the blood. The heart is taken out, and the new heart is sutured into the blood vessels. And once the anastomosis is completed, the heart will restart. This is the echocardiogram before the surgery. You can see the dilated heart, which is hardly pumping blood into the body. It is actually it is a failing heart. You can see the cross-sectional view. And this is the post-transplant echocardiogram. How brisk is the heart? It is contracting well, and you can see the same short axis view of the heart. It is contracting well. You can make out the difference.
நான் வந்து 2.5 years எனக்கு வந்து ஹார்ட் ப்ராப்ளம்ஸ் தான் டேமேஜ் ஆகிட்டுருக்கேன். அதுக்கப்புறமா ஹார்ட் ஃபெயிலியர் அப்படி சொல்கிறாங்க இப்போ 15 years 17. அதுக்கப்புறம் எனக்கு ஹார்ட் டிரான்ஸ்பிளான்ட் பண்ணாங்க. கேஆர் பாலகிருஷ்ணன் டாக்டரும் இன்னும் சுரேஷ் ராவ் டாக்டர் தான் பண்ணாங்க. இதில் நான் தான் இருக்கேன். ஐஸ்வர்யா ட்ரஸ்ட்டுக்கு ரொம்ப தேங்க்ஸ். கேஆர்பி டாக்டர் டீமுக்கு ரொம்ப தேங்க்ஸ்.
So you heard the story from the horse's mouth. The second fortunate girl is 11-year-old. Her father is a security officer. They are from Nagarkoil. She was presented with hypertrophic obstructive cardiomyopathy where the heart muscles become thick, and she also had a severe heart failure. Again, Chitra madam was kind enough to help them, and the management of MGM. On 9th December, we had a donor in a private hospital in Coimbatore, and this time we used the commercial aircraft. It took almost 4 hours before we could restart the heart in the recipient chest. And again, post-transplant, the scan was normal. She was discharged on 30th December. Thank you. That is the team of the doctors. Thank you.
Good afternoon and happy New Year. Thank you for coming to this meet. The idea of presenting this was not to highlight the fact that despite all the progress we've made, a lot of patients who require help. We've done, including our previous, where we were working in the previous hospitals, we have done over close to 350 heart transplants, which is the largest in the country. And we've been doing it from the year 2010. I think we now have a lot of data. Our 5-year survival rate is over 75%. Children like this, 5-year survival rate is around 83%, which compares very well with what is published worldwide. So the outcomes are excellent, and over the last, I think 3 years now, the Tamil Nadu government has also started funding a limited amount for the operation. But a lot of these patients don't necessarily have the requisite heart or the IDs required for the Tamil Nadu government funding. And we also have, we get people from all over the country. We get them from Bihar, from Bengal, we've had transplants done from Srinagar, which is particularly relevant in today's climate, which has been funded totally free by the trust that Chitra runs. So even at a very subsidized rate, 15 lakhs is a lot of money for patients to spend out of their pocket. You also have to understand that transplant does not end at the end of the operation. If they have to live for 5 years or 10 years or 15 years, it is an ongoing process. They need drugs which have to be taken regularly. They need tests which regularly monitor the level of the drugs. They get rejection, they get readmitted. There is no funding mechanism. Right now in our ICU we have 2 patients. We had done a transplant 4 years ago and 5 years ago. This is Sabarimala season, so one of them in a religious fervor stopped taking drugs for 1 week because Mara got it now. So unfortunately, heart does not follow these sentiments, so he rejects and comes sick, so he's on ECMO. So there is no mechanism of funding. So we have to have other mechanisms by which we take care of these complications. Because when we first started this whole program 10 years ago. The focus was on getting somebody to survive the operation. But now we are getting them to live for 20 years, 25 years, outcomes as good as published in the Western world, where the state support or the institutional support for these things is so much they don't have to worry about cost. Here, it's a major, every aspect of medical care in this country you have to worry about cost. So that's where the role of such organizations is very laudable, and I think without charitable organizations like this, high-tech and advanced healthcare will not be possible. And this meeting was just to highlight the need, the path that we need to follow. Hopefully, in the next decade, we're just starting a new decade. At the end of this decade, at least, healthcare would be a much greater priority for our society than a lot of other frivolous things that we eventually see do with. Thank you. Thank you, Kamal.
Happy New Year to all of you. Thank you for coming to this event, which is very special for all of us because it is the first event at our new place of work, the MGM, and it is very special for the two girls who are the actual heroines of today's event. They both got heart condition which gave them at best a few days or weeks to live, but thanks to the wonderful care that and the advancement of technology that our doctors have been able to save so many lives. Aishwarya Trust was started in 2008. It is the brainchild of Dr. K.R. Balakrishnan. We both started along with my father with the mission of helping children suffering from heart ailments. So we have a comprehensive program where we do a free screening program at government hospitals all over Tamil Nadu, in different government hospitals in Viluppuram, Velur, Chengalpet, and so the children are screened there, and the children who need support are brought to our hospital, and along with the government scheme, Aishwarya Trust funds and makes these surgeries possible. We are really excited to start our work in a bigger scale at the MGM hospital, and I am personally very honored and privileged to be working with this wonderful team of doctors, Dr. K.R. Balakrishnan, Dr. Suresh Rao, and all the surgeons. And I'm also very delighted that the management of MGM, Dr. Prashant, and his team, they have been so supportive of our work, and I'm happy to say that in a short span of 2 months, we have helped with the congenital heart surgery of more than 105 children, and 2 of them are 2 dear girls here who have had a complete heart transplant. I think the uniqueness of the program of Aishwarya Trust is it is a wonderful program where private NGO, hospital, and the government all work together and make heart care possible for these children from underprivileged backgrounds. Thank you. I would also like to say that there is a great need for more awareness of heart organ donation in India, and what we all can do to make this awareness possible and more donors to come forward is, I think, each one of our duty so that we should make more organs available, because there are thousands of children who are affected by this, and because of lack of either funding or organ availability, we are not able to help them. So I appeal to all of you to help us bring awareness for this cause of congenital heart defect in young children, and the need for heart transplant for children and young adults and adults who are suffering from complete heart failure. Thank you. And Limited and Deutsche Bank have been the two big organizations who are supporting our heart transplant program, and we are indeed very grateful to them. Thank you.
Questions? Genetic disorder where so we sometimes see them in siblings. We have done, I think, at least 8 or 9 transplants over the last 10 years on brothers and sisters of varying age groups. Some of them are because of previous viral infection, and some of them we've done, I think, more than a dozen now of patients who had cancer which got cured by chemotherapy, but the drug caused a lot of them children leaving sarcoma and stuff like that. So there's a whole range of causes, not always genetic issues.
But once it's cured, there is no possibility for living against it.
Transplants, you have to understand, this is not curative. The longest surviving transplants are around 35-40 years. That's a long time. But it's not very long when you're a child of 5. Historically, that's been the length. Whereas I think with current treatment that we're giving now, we think it might be even longer. But the median survival is around 20-25 years.
How long they are supposed to be in the medication?
Lifelong. They have to be on immunosuppressive drug lifelong.
So, does it affect the way they are living life?
Yes and no. People get used to one type. You have to watch your kidney function. That's the commonest side effect that you have to recover again. But most of them get back to normal life. We've had patients who run marathons and get back to normal life. We have at least, there's one man from Calcutta who won a marathon in open field. That means in a general population. A lot of these patients get back to normal life. So the quality of life is excellent.
So, how long this heart can be preserved actually?
As a donor organ?
Yeah.
That's a good question. Unfortunately, it's around 4 hours. As we speak, we are doing a transplant right now. The organ is coming from Madurai. So from the time the organ is climbed to reaching here, it's just now it's reached, I think, downstairs. It will be around 2.5 hours. So Madurai to Chennai is 2.5 hours. So imagine if there is an organ in Madurai, it's impossible to reach it to Assam or Guwahati or Tripura or Nagaland. It's not. The longest we have done is 7.5 hours ischemic time. Those are young hearts. We are now working on, we've developed a box with the Indian Institute of Science in Bangalore, where we think we can, we're looking at extending the ischemic time to around 9 to 10 hours, which will make it possible for you to go from Trivandrum to maybe Srinagar, I guess.
Isolated Trust, you are focusing only on heart transplants or any other ailments you are focusing on presently?
We actually deal with all the heart problems for children. Basically, we support congenital heart defect. The program starts with the screening and diagnosis, etc., and we help with the surgeries of congenital heart defect as well as transplant.
Only heart?
Only heart.
So, will there be any post-operative, will you be supporting the
Yes,
patients?
many of them. Many of the children who have needed medication and those who come back for biopsies, etc., for the heart transplant.
If I can add, as I highlighted in my talk, this is they have to be on constant observation. So sometimes we have 5 years later they have some other issue. For every single thing they come back to the same hospital because most people don't want to treat transplanted patients. And there is no financial support. So once we have trust them, we really need, it's not like Britain with the NHS or, where it's a difficult country. So we need more such organizations which make it possible for us to treat without worrying about the cost.
Is it not, within 4 hours you got to transplant? Is there any technology to increase the life of the...
We are looking at technology, as I said, right now, if the organ is good, we have done up to 7.5 hours. Right now we are developing a box with, as I said, Department of Engineering Design and Indian Institute of Science. But we are also involved in a research project where we think we should look at long-term storage. Like if you donate blood, you don't worry about 4 hours. So that's organ banking. So that's a research project we're doing currently. Hopefully in the next few years we'll have some kind of solution.
So these patients would be 15 years and then after that they would need another transplant?
No, as I said, 15 years is not like a license is expired. I mean, this is median survival 15 years, which means there are patients who go on for 30 years. It depends on how well you look after them. It also depends on how good is the immunological match that they get. That's a matter of luck to a large extent. But if brain transplant were to be needed, it is being done. But I think these are historical data. Our current drug regimes are much more sophisticated. So I think those children who get it now, I expect them to have far better outcomes than what we've had in the past.
So the age of the donor and the heart.
Yeah,
age of the
matters.
heart-
If it's a young donor, the outcomes are, you can expect to live much longer than if it's